back. It's about to be a lot tougher to light up a smoke in Israel starting tomorrow. A sweeping new smoking law takes effect. It bans smoking in many public places. Smoking now banned at any outdoor event, concert, festival, whatever, where there's more than 50 people around. It's banned in zoos, parks, playgrounds, anywhere you work out. Basketball courts, gyms, sport fields, swimming pools. And you can't smoke within 30 feet of the entrance to a hospital, medical clinic, or doctor's office or government office. Basically, there was a public smoking law already on the books. This goes much further. The fine, 1,000 shekels, that's about $275. With me in studio, I have our diplomatic correspondent, Eli Hochenberg, also addiction treatment specialist and expert, Shahaf Ashkenazi. Let me ask a question just about perhaps if this will be effective. Forget the fine, but the idea that it will now technically be illegal to smoke in so many places. Maybe will people be inspired to just leave the cigarettes at home? They won't take it with them. It could actually be a good thing. People won't smoke as much.
I think that it's going to push people to a corner where they have to look for a solution. This is the only good news here, because pushing smokers not to smoke doesn't help them not to smoke as it is. So this comes to in a really good time, because now we have here on Facebook, it's been going on for a year. We have free treatment with Avri Gilad, highly supported by Knesset members, where we solve the problems for free. Okay, and on Facebook, a group called in Hebrew, Mafsikim Lashen B'Yachad Achshav, and the group has been supporting thousands of smokers in the past years. And it's considered like a Wikipedia project. We're supported and we're getting donations from people all around the world for that.
Shachaf, the Israel Health Ministry says about half of male smokers smoke between 10 to 20 cigarettes a day. They smoke a lot.
Yeah.
And so these kinds of laws about where and where you cannot smoke, does it have any impact at all, or does it have to be out? You can't legislate that.
Bottom line is that smoking level in Israel has increased in the past years. Okay, we ranked, I think, at the bottom 5 of Western countries as far as the amount of smoking we have here in Israel. Israel is increasing the amount of smoking, so no, probably there's a problem from up there.
A unique thing with Israel in particular, you mentioned the increasing sales. Last year, the sale of loose tobacco grew 10%. It's a big jump. For Israel, it's a big problem starting with the mandatory army service. Teenagers go into the army. It's very stressful. Many are in combat duty. It's not always a fun thing to do, to be in uniform. You smoke, you relieve some stress, and it becomes a lifetime habit.
Let me say just nicely, Israeli governments along generations didn't do enough work to prevent smoking. This is what we're seeing now. This is once again where we're going from Facebook, which is a social media that helps everybody that wants to quit smoking. This is why we're doing it.
Eli, some would wonder how you can actually enforce this. I mean, there is going to be a fine. It's a pretty steep fine, but I don't know. You have a festival with 6,000 people. How are you going to, who's going to run around finding you?
First of all, I must say that I first thought it was some sort of an intervention you planned. But I'm happy we're sticking to the news part of it. It's not easy, because if you're looking at how the structure of enforcing it, it's on the local authorities to actually get to those who break the law and find them. And they're not really doing it. So how effective will the new regulations be? How many people will pay fines? I'm not sure. But it will create a different atmosphere, a different discourse. It will be less accepted to do that in public. A few years ago, it was applied on restaurants and bars. Somewhat successful. You probably have the data. Still many places. When you want to smoke a cigarette, you find your way.
Not an intervention, Eli, but of course, if we encourage you for your health.
I was not talking. I was asking for a friend.
But what would your advice then be to the health ministry, just from to the people that you treat and that you work with? I mean, maybe they want to quit, maybe they want to smoke less. How can the health ministry, they come from a good place. How do you tackle that problem?
Well, an addict is someone who believes that he needs a cigarette in order to have better life, as weird as it may sound. So you have to create a vision for smokers, something that is a better life, a better option, a better mental option in order to have a better life. So this is what needs to be done here.
And you mentioned before about the new option with social media, the groups and organizations that you are part of, that you work with people. It's a new options available to get help, to talk with people.
It's a new free platform that gives people real opportunity to quit with the feeling good about themselves not missing cigarettes, having fun, enjoying life, having a better life, a cooler life without cigarettes. The question you asked me before, am I still going to be cool if I...
Don't disclose that. Don't disclose that.
Shahaf Ashkenazi, addiction expert, again, speaking about the greatly expanded public smoking ban goes into effect tomorrow.